music and live talk with Muriel Dissar. This is Talk 100.3.
11:51 on the clock. A very, very good morning to you. And yes, now the reason why I'm kind of breaking the story here is because we got a call and, I have to take this person on the radio. Now, we're talking about the HPV vaccine. Now, this prevents cervical cancer. Doctors are telling parents as 90% targets, have been announced. The Ministry of Health and Prevention, MOHAP, recently launched a comprehensive national strategy to combat HPV-related diseases. Parents are more likely to vaccinate their children against the HPV virus when the vaccine is presented as a way to prevent various other things like cancer rather than solely as protection against any STIs. And this is according to reports. Immunization and screening for cervical cancer is once again under spotlight at the Ministry of Health and Prevention. MOHAP recently launched a comprehensive national strategy to combat HPV-related diseases. Now, talking to us more about this is a doctor, the doctor who actually commented on this, according to the doctor Moustafa Aldaly, a consultant in medical oncology at International Modern Hospital, Dubai. Now, he himself gave us a call and wanted to comment on the story. Let's take a listen. A very, very good morning to you, doctor.
You are welcome. Good morning, all.
Doctor, we are reading about this story now. Could you help us understand what does the story actually mean? What does it mean for parents? Because parents seem to be a little bit worried about this vaccine.
Okay. Good morning, all. I am Dr. Moustafa, Aldaly, medical oncologist in IMH Hospital. And actually, part of my experience in Egypt is to deal with cancer cervix. So actually, I sat on the other side of the river, seeing what it will end if we face scenario of advanced cancer cervix. And it's really bad scenario, better to avoid. And for the first time now we have an intervention that allows to immunize against development of cancer cells. This is not available in any other type of malignancies to have vaccine that prevent the HPV infection, which is related to more than 70% of cases of invasive cancer cervix, with nearly no or very minimal side effects that is similar to any other vaccination schedule.
Right. Now, doctor, we've heard about cervical cancer time and over again, but it becomes a little bit tight-lipped when talking about it. Would you like to educate us on this subject, and how can we women look after ourselves a little more?
Okay. For the development of cancer cervix, usually it's an adult disease developing in the mid-30s and 40s of age, presenting with usually bleeding manifestation in ladies, usually married or previously sexually active. And the disease actually presents in advanced stage unless the patient is following a vaccination schedule or an early detection and screening program. Now, the availability of vaccination for HPV has started since the years maybe 2006 with the development of the relation between infection with human papillomavirus, especially 16 and 18. And at that time, we developed a vaccine that covers 4 subtypes of human papillomavirus, especially for those involved in cancer development. With progress in science, with better assessment of cases, now the available vaccine can cover up to 9 subtypes of different human papillomavirus infection against both development of cancer cells and other wart infection. The latest recommendation is to vaccine children before the age of sexual activity. At the age of 9 years that they can start. Most of the recommendations coming below the age of 15 years for girls, having only 2 doses if they are vaccinated at this young age. And even recently, they are developing a recommendation for vaccination of boys also. The vaccine is safe.
I was reading about this, doctor, as well. Why should boys take the vaccine? And when we're talking about cervical cancer, now, do boys get affected by it as well?
Well, the issue is to vaccine against human papillomavirus that is sexually transmitted. And it can transmit it, of course, from husband to wife or from any relation. The second thing that there are correlation with development of human papillomavirus-related malignancies in males. Oropharyngeal cancer was reported, benign cancer was reported. And if you want to cut the circle, you should eradicate the vaccine in both girls and boys. Yes, it prevents cancer cervix in female, and by vaccination of boys, you are preventing the transmission of disease from any carrier in males, and also protecting them from having sexually transmitted human papillomavirus that may later on result in malignancies documented in males.
Right. Now, Doctor, one of the most, I think, talked about subjects is the fact that most people are unaware of the HPV's link to cancer, or they kind of misunderstand the vaccine safety and purpose. Would you like to educate us on that?
Well, let's say that chronic exposure to infection can lead some normal cells to transform into malignant cells. This is documented in human papillomavirus infection and the relation with cancer cervix. Also in hepatitis C virus infection and development of HCC or hepatocellular carcinoma, and other infections that correlated with development of cancer. What is different in cancer cervix that we have a vaccine that can eradicate the infection that can induce malignancy. So we cut the circle of development of malignant cells and the development of later on invasive or cervical cancer. How much there is a relation between human papillomavirus infection and development of cancer cervix? It's up to 70% or maybe higher for the development of squamous cell carcinoma. If we eradicate the infection, there will not be. You are cutting 70% of the reasons to develop this malignancy. Lastly, the vaccine safety, as it is used since the year 2006, side effects are limited to any routine vaccination procedure, like local pain, some low-grade fever, some pulling aches in the first 1 or 2 days. And there is no any other late effects documented now for nearly 20 years. And the rumors about the affection of infertility or the sexual activity is totally non-scientific and doesn't base on any research. Actually, this to protect and hold an infection that can be transformed into a disease. In the majority of cases, if there is no regular screening, present in an advanced stage and necessitate aggressive treatment options like radical surgery or radiation therapy, that really impact the fertility and the quality of life of those patients.
Well, thank you so very much, Dr. Moustafa, for being so kind, coming on the radio and educating us on this, and also taking us through every step of our worry that this vaccine is concerned. So thank you very much.
Thank you. You're welcome.
Well, looking forward to more such meaningful conversations. Now, I have an opportunity for you, and it's very, very simple. If you want to win yourself Numaish vouchers, and I have some amazing vouchers, all you have to do is just type Numaish. बस आज इतना ही कर लो. Numaish space your name, send it to me on 0586861003, and I'm giving you the opportunity of going and shopping at the Numaish exhibition that takes place at the Godolphin Ballroom, and this is all the way in Jumeirah Emirates Towers. Believe you me, you will thank me later. So jaldi se Numaish space your name, send it to me on 0586861003. Very shortly we will be joined with the lady behind it all from Numaish, and we'll get a download of wahan pe kya hone wala hai. We will talk to her and understand from her, understand her vision, what are the new products, what are the new line of, the line of fashion that is going to be displayed at Numaish. Well, if you know your wife loves it too, get her to message me right now. Just type Numaish, space your name on 0586861003.
Talk 100.3. This is Fan Network News from the BBC.
BBC News with Neil Nunes. Financial markets across Asia have made gains in trading following the earlier recovery in U.S. markets. The recovery came after President Trump unexpectedly announced a 90-day suspension of the